Connected Health Cities is a fabulously exciting programme. It's also a very, very important one for the health and social care system in the North East and North Cumbria. So it's really exciting to be involved with it. It's also attracting an awful lot of interest from industry partners, and that might not be intuitively obvious why that is, but there are a number of facets of this which are important for industry and where industry is important in its delivery. One of the things that's quite important is the access to skills. A lot of commercial companies, big companies, are very involved with very large volumes of data. They're also involved with presenting that data back to their customers and clients. So that's exactly what the NHS and social care need to do. They need to join up large data sets, they need to be on top of the analytics, they need to learn from the data, and they need to keep their customers, in this case the patients and citizens of the North East, with them on the journey. What the data is used for, how safe it is, and ultimately what happens, and the control of that data needs to sit with the patient or citizen. So the companies that are working with us or seeking to work with us at this stage are bringing skills that we don't currently have in the health and social care system, and they're bringing attributes and expertise, but they understand fully that the data is health data, it's important to the citizen, and it's important that that's kept secure. So there's absolutely no question of the data being left to devices other than that of the care system. The data will be held securely, and the data will be used with the consent of the individual. Those are the fundamental principles of Connected Health City. I think in the 25 odd years that I've worked in and around the health service in the North East, the Great North Care Record is by far the most exciting thing that I've been involved in. It has a transformative potential that I haven't seen before in terms of joining up data so that the patients of the North East and North Cumbria and the citizens of the North East and North Cumbria can get ready access to their data, and the professionals looking after them can get the information they need at the point of care. That's fabulously exciting. That doesn't happen right now. So as well as the point of care stuff, if we get this right in the Great North Care Record and get the support of the people of the North East and North Cumbria, we can create an asset for the region that helps us to run health and social care in a way and with an efficiency that's never been seen before. Interestingly as well, it creates an economic asset. That big data concept that you hear so much about, if you're trying to plan healthcare, access to data sets combined and anonymised is absolutely essential to planning care, where hospitals sit, what services they provide, what services they're going to need. So working with industry to understand how those data sets are used in planning and delivery of healthcare is part of what we expect the Great North Care Record to become. But it will only become that if the patients and citizens of the North East give us their permission to do so. That's the fundamental principle underneath the Great North Care Record, is consent from individuals to use the data for things that they understand.